Hello friends, time to discuss this week's Tuesday diagnosis drop case, which was anterior mediastinal cystic lesion in a young female. Mediastinum is divided into superior and inferior mediastinum by an imaginary line from sternal angle to T4 vertebra, and inferior mediastinum is further divided into anterior, middle and posterior mediastinum. Anterior mediastinum contains sternopericardial ligament, lymph nodes and lymphatics, branches of internal thoracic arteries, part of thymus and areolar tissue. So when we are dealing with anterior mediastinal mass lesion, differential will include lesions arising from thymus like thymic cyst, thymoma, thymic carcinomas, germ cell tumors, both benign, teratomas and malignant germ cell tumors, lymphomas, thyroid lesions, lipomas, lymphangiomas may also present in anterior mediastinum, as well as lesions arising from adjacent areas extending into the mediastinum. When we are dealing with cystic lesions, we will have differential diagnosis of bronchogenic cyst, thymic cyst. Some thymic tumors may also have solid thymic tumors may also have cystic component, dermoid cyst, as well as malignant germ cell tumors with cystic components. Other rare lesions are parathyroid adenomas with cystic component, pericardial cyst and vascular lesions. In our case, we had a cyst which was partly lined by squamous epithelium, had lot of thymic tissue in the wall. Here you can see many lymphoid follicles and Hassel's corpuscles, as well as fibrocollagenous wall lined by cuboidal to columnar epithelium with focal micropapillary structures. Thymic cysts can be multilocular or unilocular. Unilocular cysts are usually thin-walled with few layers of bland squamoid epithelium. Usually there is no inflammation or cholesterol granulomas, while in multilocular cysts we may have more layers of squamoid cells, cuboidal cells, columnar cells, micropapillary or glandular epithelium. There may be pseudoepitheliomatous hyperplasia, may have cholesterol granulomas, may have lymphocytes, granulation tissue, hemorrhage. Cysts are usually separated by fibrous septa and they also have Hassel's corpuscles in the wall. There is usually no cartilage and smooth muscle present in the wall. In bronchogenic cyst, we have a cyst wall which has ciliated columnar lining with goblet cells, mucus glands in the wall as well as hyaline cartilage and smooth muscle cells. While dermoid cyst has more components, it will have mature squamous epithelium with appendages, may have columnar lining of GI type, neuroglia, bone, cartilage, fat, striated muscles, rarely hepatocellular tissue, pancreatic tissue, retinal type of tissue, and may have also immature neuroepithelial cells. This is a really difficult diagnosis in needle biopsies because of the sampling bias. There may be predominance of one component. So it is recommended if you are doing needle biopsies, sample this lesion thoroughly, otherwise it may get misdiagnosed. So in our case, we had a cyst with thymic tissue in the wall and lining of squamous as well as columnar epithelium and absence of muscle and hyaline cartilage. It was diagnosed as thymic cyst. Thank you very much. Have a good day.